Hey there, happy Monday. This is Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible. Today I wanted to do my live outside because it's such a beautiful fall day, one of those, what they used to call Indian summer days, where everything is just gorgeous and it's warm and sunny. And I wanted to share my yard and my roses with you. So I hope you find that helpful. I want to talk today about emotions and how they get stuck in your body. In Chinese medicine, we've all talked about, in Chinese medicine, emotions are a big part of how we discuss what's going on with your health. And ultimately, in Chinese medicine, we say that disease comes from either inside your body or outside your body. And anything that comes from outside your body is really an infection. So, something that invades your body from the outside. And the root of most conditions in Chinese medicine is believed to be from inside your body, and that has to do with emotions. And we always talk about in Western medicine, we always talk about how it's all in your head, but the truth is that our bodies hold everything that we've ever experienced. So it's not just in your brain, it's also in your physical body. And they can get emotions can get trapped for years when you have negative or frightening experiences. And there's a lot of science lately about trauma and how trauma impacts our bodies. But there are also things that are maybe not quite directly traumatic that may still affect our bodies. I'll give you an example of a patient of mine that I saw several years ago. He was a firefighter, actually, and he came for acupuncture for his injured knee, and he had a few sessions and he never really got any relief, but he wanted to avoid surgery, so he kept coming for acupuncture. And because I'm used to people getting better really quickly whenever I work on them using acupuncture, and when he didn't get better, I started asking him about stresses, and he said, "Oh, my life is great, I don't have any stresses, nothing's really wrong with me." And then uh And I kept asking him, he had like 4 sessions by now, and I kept asking him about stresses, and he said, "Oh, yeah, I love my job, I love my wife, and all of this." And then one day he came in and he said, "Oh, I just had lunch with my dad." And I asked him, I said, "Oh, how was that?" And he said, "Well, my dad's an alcoholic." Well, so now there's a lot of issues when one of your parents is an alcoholic. It's pretty well known what happens. And so I started talking to him about having a childhood where his father was an alcoholic, and he was interested. So he began to research the being a child of an alcoholic. And the next time he came back, he was like, "My knee's starting to feel better." And so that's one of those stories where, you wouldn't expect something like a knee pain to be connected to any emotion. But when he started digging deeper, he found that it was connected to his relationship with his dad. So today we want to bridge that gap between, or bridge the ancient wisdom and modern science about how the emotions and your body are connected. Now, in Chinese medicine, I love, as you know, I love Chinese medicine. It's always every organ has an emotional and a spiritual function in addition to many other physical functions that you're not necessarily aware of. So, like the liver rules the emotion of anger and frustration, and its job is to get things done. So, when you can't get things done, you can start to feel stuck. And if you have anger, you could be holding tension in your neck and shoulders. You could have migraines, you could have high blood pressure. Those are all connected to liver energy movement. The heart rules the emotion of joy, but also is considered the emperor of all of the emotions. So it's connected to unprocessed trauma and heartbreak, and uh, because it rules sort of every emotion, it can be connected to lots of physical traumas that people experience. The spleen, which rules your digestion, your ability to take in food and to transform that food into energy, rules the emotion of worry. So when a person has a lot of anxiety and can't stop thinking, that like thinking that kind of goes on and on and on that you can't stop, that's connected to spleen imbalance. The lungs rule the emotion of grief, and the lungs again rule your nose, your throat, your physical lungs, your large intestine. So it's a whole system of organs, just like every other Chinese medicine system, and it rules your immune system. And so, a lot of times when people are experiencing grief, they will have something like a cough or a runny nose, or they'll get sick when there's a new grief in their life or a new loss in their life. You might feel like if you were experiencing grief, one thing could be a chronic cough, but another thing could be chest tightness or feeling tightness in your shoulders or even sort of tightness here in the front of your throat or congestion or lots of sneezing. Those are all symptoms that go along with possibly the emotion of grief. And the kidneys rule the emotion of fear and chronic stress. And in Western medicine, of course, the kidneys rule your adrenal glands. And so you might have low energy, or you might have low back pain, or you might feel physical fear in your body because kidneys release cortisol. So the key point is that you can't separate your physical body and your emotions. So I'm going to give you some from modern science, like the vagus nerve and the nervous system are very much connected. And of course, there's new science or a lot of conversation lately about the vagus nerve and how it is connected to our experiences of trauma. And so you could have uh, a trouble, like a feeling of constantly feeling tight in your throat. You might not be able to digest your food if your vagus nerve isn't working well because it helps you digest. You might have palpitations and feelings of heart imbalance because, again, the vagus nerve regulates all of these. It comes out in your neck from under your ear from the brain and it goes down. It's the longest nerve in the body. It goes through your heart, your lungs, your stomach, your small intestine, your large intestine. It goes through your entire digestive system. So, any sort of symptoms that are connected to stress could be connected to vagus nerve dysfunction. So, here are some examples of unprocessed grief, like I talked about chest tightness. Chronic anger can cause neck, shoulder tension, migraines. Uh, you can have digestive issues from chronic, it's like gas and bloating and pain in your belly from chronic anger. When you have chronic anxiety, you could have stomach problems or inability to sleep or inability to focus. Those are all connected to digestive issues. And most of us were taught to suppress our emotions. So when we may not even be aware that we have any emotions. I remember when I mean I've had many sort of my own chronic health issues, and I did not know that they were connected to emotions because, of course, when I was a child, I wasn't okay to have emotions. And so many of us have that sort of experience where we're not allowed to experience our emotions. And so we hold them in our bodies. And that is what we can, what we experience. So I'm going to give you a couple of little suggestions of how to figure out what emotion might be connected to what you're experiencing physically. So, first of all, is recognizing that you have this experience of tightness in your chest or throat or in your gut. And you could do a scan just to see, okay, where, like, first of all, recognize that you have it. Second of all, think about what emotion might be connected to it. So, you know which organ is involved. You might also know what emotion you could be having. And then you can kind of examine yourself. And then you can do some self acupressure. And I will dedicate my next live to showing you some acupressure points for each organ so that you can release that. Because right now I'm outside and it's a little hard to do that outside. And then there are some other things you can do. Of course, there's always breathing. There's always tapping along the meridian. So I've shown you a few videos where you can tap along a particular meridian in order to release the emotion as much as you can release the physical sensation. Now, one of the reasons I love acupuncture is because you don't actually even have to think about your emotions when you have acupuncture because it's all a part of the same system so that you can release your emotions when you're having acupuncture and you can have a healing of all the layers of that. Couple suggestions of what you could do today. Anytime you feel like you're stuck in some emotional situation, you can always breathe. And you breathe in for a count of 4, you hold it for a count of 4, and then you let it out for a count of 5. There's some new science that says the exhalation is actually what helps you release the emotion. The second is that you can check into your own body and see, what are you feeling and how can you make that feel better? And then think about where that emotion is being held and what it might have to do with what's going on with you. So, I wrote the book Healing When It Seems Impossible, and one of the chapters is about the emotions and how they're connected to your health. And I want to tell you that your body isn't broken. It's trying to tell you something, and it's still your friend, even when you're feeling uncomfortable. And it doesn't come from your healing doesn't come from ignoring what your body's trying to tell you. It comes from listening to it. So, even if you can't figure out what to do, one simple thing that you can do is just ask for guidance from your higher self, or if you pray, to set out a prayer that helps you release whatever it is you're hanging on to so that you can feel free again in your body. I hope you found that helpful. And leave a comment and tell me what maybe you might have been sitting with, what part of your body is having a hard time. Thank you so much. Have a wonderful day, and I look forward to chatting with you soon.